Hi everyone, I'm Sarah and welcome to our second Mums and Bubs class. Hope everyone that joined us last week really enjoyed it. So today, before we get started, we'll just go through a few of the warnings for the class. So as I said last week, we would really recommend that you are at least 6 weeks post having your baby before you start the class, and ideally that you've had your checkup with your GP before starting. And then we'd really recommend that you probably had a telehealth consult with one of our physios before starting, if you are close to that 6 weeks, just after having your baby, just to check through that there aren't any risk factors for you starting the classes. The other things that we like to warn about is if you're getting any significant back or pelvic pain, if you're having any bladder or bowel issues, if you're having any pelvic organ prolapse type symptoms, or any significant tummy muscle separation after having your bub, then we'd recommend that you did have a consult with one of our physios before starting the class. Okay, so we'll get started. Like I said last week, with each exercise, I'll give the base level exercise and then we'll give a few progressions as we go through it. If it is your first class or you're close to that 6 week mark, then just stay with the base level exercise, check that you've gone all right after the class, and then maybe each week just try and slowly build up to it. But if you are getting any pain or something doesn't feel right, then just go back to that base level exercise at any stage during the class. Okay, so we'll start with just some stretches. So what we might start with today is just a bit of a hamstring stretch. So I want you just to bring one knee in towards your other thigh. You're going to turn towards that leg and you're just going to lean forward. So ideally trying to keep a nice long spine, reaching forward. So you should feel that stretch just at the back of your leg. And coming back up. So while we're here, I'm going to get you to turn towards the bent knee. Going to get you to reach up nice and long and tipping over. So a nice stretch through the side of your spine. It's a really common area to get tight if you're getting any back pain or really postnatally. Good. Okay, coming up, knee in. Turn towards the straight leg and leaning forward. So you should feel that nice stretch through the back of the leg. So while we're stretching, I should have mentioned before we started that if you don't have any equipment, that's perfectly fine for the class, but we will be using a couple of the bands. So we'll be actually using a loop band and a longer TheraBand that we'll use and attach onto if you're close to a door or something like that. But again, if you don't have any of the bands, then that's fine as well. I'll give you alternatives without the band. And also, if you want to include your baby in any of the exercises, then I'll let you know which exercise is appropriate for that as well. Okay, so coming out of your hamstring stretch, going to turn towards bent knee, reaching up, tipping over, so getting a nice stretch through the side. So it should just feel like a nice, comfortable stretch. Good, coming back up. Okay, last one, you're just going to cross one leg over the other one and then just gently lean forward, letting your knees go out wide. So you should feel this stretch sort of in through the glutes. So it's okay if you can't get your knees down. If your knees are up a bit higher, that's fine. Just come to wherever feels comfortable with this stretch. Good, and then swapping over. So other leg in front, and then coming forward. Just reaching to wherever feels comfortable for you. And coming back up. Okay, so we're going to start off with some pelvic floor exercises. So hopefully you're all doing some pelvic floor work each day. So to start with, we're going to be laying on our back. Now with your pelvic floor squeeze, it can be quite tricky to know whether you're actually activating your pelvic floor correctly. So So the cues that I will use is that imagine you're trying to stop the flow of urine if you're going to the toilet. So you've got that squeeze and a bit of a lift, or trying to stop the flow of wind. Okay, so laying down, relaxing everything else off. So everything else should stay pretty relaxed. Try not to squeeze through your bottom or through your tummy too much when you're doing your pelvic floor. And we're going to just start with maybe a 2 or 3 second hold. So squeezing and hold. So think about that, stopping the flow and relax. So a bit breath in and out in between. And then squeeze, hold, 1, 2, 3, and relax. So we're going to go for about 10 reps. Okay, squeeze again, hold, 1, 2, 3, and let go. And squeeze, and let go. And squeeze, and let go. Really make sure that you're relaxing when in between each one, so that you're not squeezing and then continuing to hold. So squeeze, hold, 1, 2, 3, let go. We've got about 4 to go. And squeeze, and relax, and squeeze and hold, and relax. 2 more. Squeeze and relax, and 1 more. Squeeze and relax. Okay, so we're going to add in some quick activations now with our pelvic floor. So what I'm going to say is on, off, and I want you to just try and follow with the squeeze and relax, okay? So these ones are a little bit trickier, but they are really important for things like being able to train your pelvic floor to activate quickly when you cough or sneeze or something like that. Okay, so for relaxing, and we're going to go on, off, 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 and relax. Good. Okay, so next exercise, we're going to move on to some of the core work. So if you do have a band, I'll get you to grab that. So you want to either attach the band around the leg of a chair, or if you've got a little knot in it, you can jam it in the door and get it to fix in the door, okay? So get it to where you want it to. Have a lay on your back. And grab hold of the band. Okay, so in this position, I want you to just find a really neutral pelvis. So you don't want it to be too flat, don't want it to be too arched through your low back. So find neutral pelvis. And then I want you to engage your core a little bit. So if you remember last week, we talked about activating our transverse abdominis, which training that will help to strengthen that connective tissue between your abdominal muscles where you might be getting a little bit of a separation, which is completely normal after having a baby. But we want to strengthen that up so it helps to give it better integrity. Okay, so what I want you to do with your core activation is imagine that you're drawing your lower part of your tummy just down 1/2 centimetre towards your spine, or it's like you're drawing your tummy away from your pants line just a little bit, so you get a gentle tension. So activating, and then we're going to add in some arms. So you're going to pull arms down and coming back up. So we're just adding some arm work into that. If you don't have the bands, that's perfectly fine. You can just do the arm movement. So we're still training your core with some arm movement. Or you could have some small little hand weights, like some 1/2 kilo hand weights to add a bit of resistance in. Or if you don't have any hand weights at home, you could get some 600 ml bottles of water or something just to give a little bit of resistance. So as you're moving your arms, your spine should stay relatively still. So just check that your back muscles aren't starting to tense up. So if they are, just relax again, engage your tummy, because we want it to be mainly tummy and arm work. Good, so we'll do 2 more here, and then we're going to add in the next step to this. So if this is hard enough for you at the moment, if you're just still trying to coordinate what's going on with your core and the arms, and that's perfectly fine, to stay with what you're doing here. If you want a bit of a progression, we're going to add in a little leg lift with the arms. So you're going to lift the leg to that 90-90 position, or what we call your tabletop. As the arms come back, you're going to lower the leg. Then you're going to swap to the opposite side. If you're finding adding both in is a bit hard coordination-wise, then you can either just do the legs or just do the arms. So as you're lifting the leg, you want to make sure that your pelvis is staying pretty still, and it's just the hip and knee moving. Okay. So you should feel that your tummy just has to work a bit to control what's happening at your pelvis and to assist with the leg and arm movement. If it feels a bit jerky and shaky, that's okay. What we don't want to see when we're doing any of these abdominal exercises is that your tummy's puffing or anything like that, or you're getting a little bit of a doming. So it means that that's probably a little bit of a too hard a progression for you at the moment. So let's just do 2 more each side. Good. Okay, if you've got the bands, then just give your arms a little bit of a rest, give your back a bit of a stretch out as well. So next progression here, if you want to, is then adding in a bottom lift or a bridge to the arm, same arm movement. So grab your bands again. Okay, and we're going to go into a bridge. So you're going to push through your feet, lift your bottom up and bring the arms down at the same time. And then you're going to lower your bottom down, arms come overhead. So we're going to go for 20 of these if you can. Like I said before with the other progression, if just doing the arms is enough, do the arms. Or if your arms are getting a bit tired, then you could just do the bridge. So you work to the level that you feel is comfortable. If you're wanting to involve bub in this exercise, if you're using the bands, I probably wouldn't at this stage, just because it's a little bit dangerous. If you're just doing the bridge, then you could pop bub on your hips if they've got good, if they're sitting and those kind of things, and they could just sit on your hips to add in a little bit of extra weight. Otherwise, if they're off having a nap or something, then just enjoy having a bit of time to yourself. Good. So I'll go for another 15. So you should be starting to feel this build up a little bit in your bottom, a bit of a stretch through the front of your thighs. That's another area where we often get quite tight after having a baby. So if you're feeling that sort of stretching through the front, the hips and thighs, that's normal, and that should get better the more you get stronger. Okay, we're going to do 6 more. Okay, last one. Hopefully you're starting to feel that a little bit in your back, bottom, thighs. Okay, have a little rest. So pull knees in, hug knees in, stretch out through that low back, couple of circles if it feels comfortable through your back. Good. Okay, last exercise here with the bands if you're still going with them. Like I said before, you can do this without the bands as well. So this is a little bit more challenging for your core. So if you're closer to the 6-week mark or you're just starting exercising again, then maybe go back to one of the exercises we've just done before. So what we're going to do is bring one leg up and then just watching what your tummy does, you're going to bring the other one up. And what we're hoping for is that you're not getting too much puffing through your tummy or doming. If that's happening, then I want you to come back down, okay? So this is our set position, our tabletop position. Then we're going to add the arms in. So you're going to pull down and come back up, keeping this set position. If you don't have the bands, just do the arms. It'll still be working through your tummy, or add those little hand weights in. If you're feeling that, so if you keep going with that, if you're feeling that tabletop, double leg tabletop position was too hard, then I just want you to go back to maybe one leg lift, but same arms, and you might do 5 on one side, swap, 5 on the other, okay? So coming up, if you're still going, keep going. So we're just going to do 20 here. So assume you've probably done at least 5. So just do 15 more. If you get if you're good in this position but you might fatigue after 5, then just come down and then come back up and reset again. So you should feel like your tummy muscles are working and your back muscles are fairly relaxed. As we fatigue, if we're if our tummy muscles are fatiguing in this position, our back might switch on a bit, and that's just a sign that you need to bring feet down and reset again. So just watch for that. Good, 5 more here. And last one. Great. Okay, so get rid of the bands. Again, bring knees in, stretch out, and a couple of circles around. Good. Okay, so next exercise, we're going to use a loop band if you have one, but like I said, if you don't have one, that's fine. You can still do the exercise without the band. The band just brings in a little bit more resistance. So bring the band up above your knees. Okay, with these couple of laying down exercises, you can add bub in if you want to, if you're happy to have them sitting on your hips, okay? So with this one, feet about hip width apart. Again, a bit of a focus on your tummy. So I want you to try and engage that tummy like we did before. So drawing the tummy down just like 1/2 centimetre from your pants line. So you should be able to feel a bit of activation if you have your hands here, like just a bit of gentle pressure, so not really hard. And then what I want you to do is move one knee out to the side just a little way and come back in. Okay, and then to the other side. So what we're wanting is that leg that stays still to be really, really still. We don't want it to drift across, and we want your pelvis to stay really still. So if you put your hands on your pelvis, then that will give you good feedback. And your leg doesn't actually have to go very far for you to start to feel that your tummy is working hard. So without the band, this is still a good exercise. With the band, you've just got a little bit more to control. So as you come in, you're having to work to control the band in, not just letting it fly back in. That's good. So it makes some of those hip muscles work a little bit harder as well. So make sure the thigh leads, not your foot. So you're just coming out and back in. Out and back in. So we're just going to do 5 more each side. So if you're getting tired, then just make the range a little less. Good. We've got one more each side. Good, and have a little rest. Okay, so you might just rock your pelvis backwards and forwards to just stretch out through your back. Good. Okay, so we're going to go back on to doing some bridging. I know we have just done some, but building up your bottom strength is really important after having a bub. So with the band, you're going to have a gentle push out against the band, so not too wide. You still want your knees in line with your hips, and keep that pressure the same as you lift up and lower down. So pushing up and lower down. So if you don't have the band, you're just doing another set of bridging, hands by your side. If you want to work a little bit harder, then as you come down, maybe only come down halfway. So you're sort of still under tension and come back up. But if the full bridge is enough, then just stay with that. That's perfectly fine. And then really work on that band, that it's staying really even as you go up and down. And that'll just make the sides of your bottom work that little bit harder. Good. Okay, so we're going to do 10 more here. Okay, if you need a rest, have one. So nice, slow and controlled movements make you work harder. Think about what your pelvis is doing, that it's staying nice and even, that we're not dipping on one side. So 5 more. Good, 2 to go. Good, and have a little rest. So we might just rock our knees side to side this time. Okay, next one, last glute exercise in this lot. I'm going to get you onto your side. So we're going to do some clams with the band or without. And by your side, you might have Bubs sitting here if you want to. Have your hips stacked up on top of each other, so you don't want to be too rolled forward or too rolled back. Knees and feet together. Okay, if you want, try and engage your core a little bit. And then what I want you to do is just keep heels together, maybe a little bit of slight pressure between your heels, and lift the top knee and lower down. So only come up as high as you keep your pelvis or your hips on top of each other. If as you lift you start to rock back a bit, you've gone too far. So really just want it to be knee lifting up, pelvis staying still. And then slowly back down. So as you lower, your bottom muscle should still be engaged that whole time. Good. And lower down. If you're finding this okay and you feel like you want to work a little bit harder, then again, like the bridges, just come down halfway and then come back up. So you're just working a little bit harder, muscles under load for longer, slowly back down. Good, so you should be really starting to feel it around the side of your bottom. Okay, we're going to go for 5 more here. So focus should be here. You shouldn't be feeling too much on the inside of the leg. So 2. and have a little rest. Okay, onto the other side. Okay, so coming down onto your elbow, hips stacked on top of each other, knees slightly forward, feet and knees together. Engage through your tummy and then lift that top knee and then slowly lower down. Good. And just watch as you lift that you're not rocking back. So really try and keep this leg planted firmly on the ground. Check that that's not rocking either. Okay, we'll go 10 more here. Good. So really should be starting to feel that burn. Seems to come quicker on the second side because your bottom leg is working to stabilise you as well. So it's already a little bit tired before we get onto this side. Okay, and we're going to do 3 more. And 3. Okay, hopefully you all felt that. Okay, so moving on, we're going to go into a thigh stretch. So if you've got the band, we'll use those again. If you do have any knee issues, this might be a great exercise for you. You can try maybe popping a small pillow under your knees to see if that helps. But if it does cause you any pain through your knees, it's better probably not to do the exercise. So what we're looking at is holding onto the bands, arms are straight, and then we're going to be leaning back with our body and then coming forward again. So the bands just help to give you a little bit of stability. If you don't have the bands, then I just have your hands out in front and you're leaning your body back, so you're hinging at the knees and then coming forward again. So what you want to think about with this exercise is keeping your body really still. So try not to drop through the hips or try not to arch through the back is probably the other common thing people do. So you need to engage your tummy. Even if you're just going a couple of centimetres back, you'll really feel that, like you'll feel it work through your thighs, through your tummy, okay? But if it hurts at all, then just give this exercise a miss at the moment. Good. Keep going. So if you've got the bands, it does allow you to go that little bit further because you've got a bit of support and a bit of pull to come back up. Good. Really engage through tummy. This is a really good one for helping to improve your posture, because obviously after having a bub, your where you think your centre of gravity is a little bit different because it's being pulled differently during your pregnancy. So it takes a little while to relearn, you know, how to stand and sit ideally, how to move and control your body well, especially because you're probably doing a lot of long periods, holding your bub, feeding your bub, and that's making you tight as well. Okay, so you should start to really sort of feel that through your thighs. So we're just going to do 2 more and then give you a little rest. As you're getting tired, just maybe reduce your range a little bit so you're still keeping good form. Good, and have a little rest. So sitting back and just going into a child's pose stretch. And coming back up again. So we're going to do 1 more round. I'm going to show a progression for you to try as long as your knees are okay with it. So I'm going to do it without the band this time. So you're going to come back into your thigh stretch, a little hold. Then you're going to sit into your hips, come down into a seated position. So I've just hinged at the hips to do that. Then we're going to come back out. So So we're back into that thigh stretch position and come back up. So if you're only new, haven't done this exercise before, just stay with the standard thigh stretch. That will be enough. But if you've done this before and you feel like your control was okay, so go to there, then you're going to sit in, come back up and come forward again. So this is a good one for trying to relearn just hip movement without getting your back to help as well. So we're sitting into hips, coming back up. So it may look easy, but it can be quite difficult to just get that pure hip movement as you sit down. Good. Good, and we're going to do 2 more here. So you should definitely be starting to feel it. Last one, sit into it, come back out and come back up. Okay, have another little stretch. So sitting back into child's pose, stretching forward. Good. And relax. Okay, so what we might move on to now is a little bit more leg work. So we've done a fair bit of legs and glutes today. So if you've got your band, grab your band. You're going to pop that on. Up above knees to start. Okay, and then come on up into standing. Okay, so we're going to start with some squats. So we did these last week. If these feel too hard or you just feel a bit heavy doing them, then you can try doing some wall squats. So that's just where you're leaning up against the wall with your bottom and your back and just doing some little slides up and down. Okay, but if you're feeling okay with your squat, you want to have your feet about hip width apart and want you hinging from the hips. Bottom goes back, knees bend, sitting down into it and then coming back up. So bottom sticks back, knees track over the mid part of your feet and then pushing back up through your heels. So bend knees, bottom goes back and pushing back up. So if we show you side on, it's like you're going to be sitting into a chair. Good. You don't have to stay upright. So I want you to sit into it, and that way you get a bit more bottom work and then pushing back up. So if you've got bub, you can hold on to bub to add a little bit more weight if you want that. Good. 10 more here. It's probably not going to like me tomorrow because we have done a little bit of leg work today. But like I said, if anything doesn't feel right, just make sure you stop if you're getting any pain during the session. If you're a little bit sore tomorrow, like just normal muscle soreness, then that's okay. But if you're sore, quite sore, for a couple of days afterwards, then you probably have just overdone it a little bit. Good. Let's do 5 more. You can probably all tell that my counting isn't great. Good. And we'll go with the last one. Good. Okay, so just give your legs a little bit of a shake. So if you found like the squats were enough, then just stay with that for the next round of exercises. For those of you that want a little bit of a challenge, we're going to go into a squat and then we're going to do a tap. So what we're going to do is transfer the weight onto your standing leg and you're going to do a tap back on a diagonal and come back to the middle and then tap and come back. If you do have something to hold on to, like if you've got a stick or broomstick or something, then sometimes that can really help with your stability. So grab that if you've got it, or a chair if you can bring close by, and that might just keep you a little bit more stable as you do your tap. So what we're looking for is that your hip, knee track over your mid part of your foot, and that as you do your tap, that it's staying relatively still, so you're not getting too much of a side bend. And what I'm hoping is that, yes, you'll feel a bit of quad, but you'll feel a bit of bottom working as well. If you don't have the band, again, it doesn't really matter, you'll still work really hard with this exercise. Okay, 2 more. Good, hopefully you felt that. I definitely did. Okay, so coming back into squat again. If you're just doing normal squats, then just come back and do normal squats as you feel you're able to. Into your squat, checking that this is all lining up, so not wanting hip out to the side, and then tapping, tap back. So if you find that you tend to lose it the further you go with your tap, then just keep it nice and short, so it can just be that to start with. So if any of you have done our clinical equipment program here, it's a little bit like the scooter exercise where you're standing at the reformer. It's a really, really good exercise to do to build up a bit of stability in your glutes. Helps get you strong for getting Bub in and out of the cot, picking him off the ground, in and out of the car. Okay, 3 more we'll go with. And have a little rest. Okay, you should be feeling your thighs and your bottom hopefully. Okay. So to finish off, we're just going to do a few stretches. Okay, so after doing all that thigh work, doing quad stretch is probably a really nice thing to do. So bringing that heel towards your bottom. If you've got a chair, grab onto that, it'll make life a little bit easier. Heel to bottom, knees close to each other, and then if you're not feeling this stretch, then just bring that hip forward a little bit. Good, and swapping side. So heel to bottom again. It's often a really common area to be very tight after having a bud. Yep. Good, and then coming down into a hip flexor stretch. So that's that other spot that you tend to be quite tight. So you want to set up so that your knees are at 90 degrees. Then I want you to think about tucking your tailbone under a bit, lunging forward into that a little bit so you feel this nice stretch in the front of your thigh, front of the hip, but you're not feeling any pain in your low back. If you want a little bit more, then reaching this hand up, and then you can tip over. And coming back. Okay, swapping sides. So 90-degree bend, tuck tailbone under, lunging forward. Then if you want, reaching that arm up and tipping over. Good. Okay, just to finish off with, we're going to do a mid-back stretch. So coming down onto your side. Last week we did a bow and arrow stretch, which is with both arms out straight and then rotating back, which is a really lovely one to do, but I'm going to show you a different one this week. Very, very similar, but just targets the upper back a little bit more. So I want you stacked hips on top of each other, and then you're going to bring your arms behind your neck, elbows together. So it might be a little bit uncomfortable without a pillow. So if you've got a pillow or a rolled up towel, grab that if your neck feels a bit uncomfortable. And then what I want you to do is open up through that top elbow and rotate your chest around, and then coming back. So breath in, out as you're rotating out. Breath in, out, lengthen into the stretch a bit more, and then coming forward again. Breath in, out as you're opening up. Breath in, out, sink into it a little bit more. Good. Still keep hips stacked on top of each other. And then coming back to the middle again. We'll do one more. Breath in, out, opening up. Breath in, out, relaxing into it. And come back to the middle. Okay, and then on to the other side. Okay, hips and knees stacked on top of each other, hands come behind your head, elbows together. Breath in, out, elbow goes back. Breath in, out, sink into the stretch that little bit more. Come back to the middle. Breath in and out. Breath in, out, relax into the stretch. And come back to the middle. Breath in, out. Breath in, out, stretch. And coming back. And we're just going to do one more. Breath in, out. Breath in, out, sink into that stretch, and then come back to the middle. Okay, and we're all done. So I hope you've enjoyed the class. Like I said last week, if you do have any feedback or any questions, or if you did have some pain that you wanted to talk to one of our physios about, then just give us a call and one of us will get back to you really soon. Okay, see ya.